All right, just going live on Facebook here. Good, we're live on Facebook. And, oh, I see, new link. Well, yeah, probably. All right, what I'll do is I will put, I'm going to put this in the Facebook feed here. The Zoom invite I just put in the Facebook feed. So you should be able to get that. I see there's 7 attendees here, and I'm going to allow everyone to talk. It seems like it's working just fine. I'm going to allow everyone to talk. The Zoom invite I just put in, so you should be able to get that. There's 7 attendees here. All right, but mute yourself. I'm going to talk. It seems like it's working just fine. Yeah, Facebook's a little delayed. There you go. Yep, you bet. We're good here. We are good now. So I'll just let everyone kind of get adjusted to this. We got 20 people on Facebook so far. We got people joining us. Everyone's muted on Zoom, which is great. If you'd like to join this gathering, feel free to come to the Zoom meeting. The link is in the Facebook page. I posted the link there, and I will add audio. I will give you, I will click on the audio for you and just mute yourself. And I'll keep strolling through that, mute yourself. And then what we could maybe do is we could have some people kind of chime in a little. And that should be pretty cool. So we got like half the people on Zoom, half the people on Facebook. Okay. So that looks good. Technology is going to work here, guys. It's going to work. All right, and then we're recording in both places. So we got an interesting day today. Today is Cinco de Mayo. As we know, I have some really, I have some key updates here. And by the way, if you get muted, that was me that muted you. I could do that manually, which is great. Okay.
Zoom.
I just did it to my sister. She just got muted. All right. So we have a couple really important updates here. There's some new clinical presentations that are happening that I want to talk about that people were seeing in Great Britain and now we're seeing in New York at least. And this has to do with kids. So this is a big deal. And then we'll talk a little about kind of from the standpoint of like what's kind of this next phase looking like, because we've been talking a lot about this, but I want to break it down again for everyone because it's something that I'm struggling with to kind of get my hands around and to kind of just like digest. And I want to talk a little about it and even get some feedback from you guys. But before we get started, I want to make a couple comments here. Number one, Cinco de Mayo is celebrated here in the United States. It's only been really celebrated here back since FDR's times. And, it comes from Mexico, and I'm wondering if anyone knows. A lot of people think it's Mexican Independence Day. It's not Mexican Independence Day, and I'll tell you my ignorance on this is I did a little research on this. So it's not that I didn't know this off the top of my head, but I did do some reading and found out that it was in a battle of Mexican independence. Like throughout, they got independence and then they kept fighting in Mexico. but they were fighting the French. And Cinco de Mayo was the victory in the Battle of Puebla. Now, what's so significant about this is that the Mexican army that was fighting here, I'm sorry, I could have gotten that wrong right here. I don't know if they were fighting. One sec. Could have been the Spanish, maybe. Yeah, I think it was the French, right? Yeah, it was the French. So what's significant about this is the Mexican army had a much smaller number of soldiers. They were far outnumbered, both technologically and just from the troops of the French, and they still won. Okay, and so the Cinco de Mayo was fought on May 5th, 1862. And what we should take, how do we apply this to all of us here fighting a different enemy, right? We are fighting COVID-19. And we are outnumbered in a sense from COVID-19. COVID-19 has far greater ingenuity, simplicity, sophistication in how it is attacking humans and infecting us and killing us. And so how we respond to that needs to be much like how the Mexican army responded. They were relentless. They didn't give up. They found ways to work together, right? They kept their eye on the future. And all of these things allowed the Mexican army to defeat the French army. And this is the same thing that's going to have to happen with humans and COVID, in that this has to be us versus COVID. Okay, we can't have factions within us, right? Once we start having factions, then ultimately we're just going to have a much longer battle here, and a lot more people are going to suffer. Now I'm just opening up all of these. People, your access to speak here. So cool. So we got a nice crew here. And the second important part of today is much more special and much more meaningful here. You know, I was supposed to see my sister this year. We had planned to meet in Belgium, and we're not going to be able to do that because of COVID. So today happens to be my sister's birthday, Felicia Rosh, who is on this call. And so I want to do two things. In celebration of the Cinco de Mayo, of celebrating my sister Felicia's birthday, and for all of us to be here together. And since we can't be in Belgium, I brought a beer from Belgium to drink during this call. And what I also want is for everyone to take a minute and just to add in the chat or to put in the Facebook comments to write happy birthday, Felicia, Felicia. And we're going to drink not only to Felicia, but we're going to drink to all the birthdays that we've missed while doing these. We're going to drink to all the birthdays where people haven't been able to formally get together. And we're going to do it COVID style. So happy birthday to Felicia. And here's my Belgium beer. And it could be a little better with you guys in person, but it's pretty damn good right now. All right. So Let's dive in to a really important update here. It's especially important because it has to do with kids. And it is a little concerning right now. Very, very small numbers, but it's a little concerning. So there are cases that are coming out of New York right now about kids who are having an inflammatory condition that is similar to something called Kawasaki disease. There's elements of this. You could look up Kawasaki disease. Um, I'll just type it in the comments here on Zoom. You could look it up. So a lot of these kids, they're coming in, you could get coronary artery vasospasms and almost like heart attacks. You could get really high fevers, rashes. It's a pretty terrible condition to have. I've seen cases of it. If there's any pediatricians on the call, I'm sure you guys have seen cases of it. And I think there are about 12 cases in New York, maybe a little more, of patients of kids coming in with Kawasaki-like syndrome. And of those, half or close to half ended up testing, well, 10 of the 12 ended up testing positive for COVID-19, either through diagnostic testing or through serological testing. So what that means is either those who were currently infected with COVID-19 or those who were recently infected from COVID-19 have this. Now, maybe it's just correlation. Maybe it's like an association, and it's not necessarily a causation. We have to prove that it's a causation. But the good news is none of those kids have died, but a lot of them, of the 12, I mean, it's not a lot, but those 12 is a lot. They are requiring blood pressure support. So they're requiring inotropic agents to squeeze their vessels to keep their heart pumping and their blood pressure up. And this is concerning. They're in shock. Their blood pressure is very low. So keep an eye on this because why is this so important? Because we're told that COVID-19 is not really impacting kids too much. And that is true, right? Relative to older adults, it's not impacting kids. At least we're not seeing mortality. But as a disease progresses, as a new illness progresses, and we have historical reference for this, right? When HIV was first kind of presenting itself, it was doing it with opportunistic diseases. People were seeing things like Kaposi sarcoma, right? These rare cancers that doctors hadn't seen in a long, long time, and they were only seeing it in immunocompromised patients. They would only see it in immunocompromised patients. And so 20 years later, right, we learn of all the other manifestations that HIV could cause. And it's looking like, right, that's the same with things like COVID-19, in that while early on, it seemed like this was just a respiratory illness, that maybe it's like the flu in not for mortality, but for the sake of it causing a respiratory illness, and that it's droplet and aerosolized, right? It's like the influenza in that sense. It is clearly doing a lot more pathophysiologically than we could have ever imagined. In 20 and 30-year-olds and 40-year-olds, there's a journal article that was just published in New England Journal. These individuals are presenting with large vessel strokes. And what does that mean? That means you may have a 40-year-old, someone like me in my mid-40s, who is presenting with a stroke-like illness. So I may have difficulty speaking. I may be confused. My arm or leg may not be working as normally. That that individuals like this are staying at home because they're afraid to go to the ER. They have weakness in their arm, but they're afraid to go to the ER. And what happens in those cases is these individuals are not being able to seek the care that they need in time, right? Because you could administer, it's a stroke. It's no different than a stroke in the sense that COVID-19 is causing a coagulopathy. And what that means is it's causing people to have clots, especially young patients, young individuals. It's causing them to have clots, and it's causing strokes. They may end up surviving COVID-19, but they're having strokes that could have irreversible impact. So it's important to know that if you have a symptom of a stroke, classic stroke-like symptoms, dysarthria or difficulty speaking, slurred speech, numbness, tingling, confusion, you should go to the ER, okay? Because you could get the appropriate test. You could be told that you have a clot, and you could be given the necessary medication for that. And that's really interesting. And there is no doubt in my mind that these things are related as far as what we may be seeing in kids, or what we're seeing in middle age, and what we're seeing throughout the gamut of age groups here is the impact of the kind of multifactorial impact that COVID-19 is having. It's profound. So these are real, and when you're reading about it in Yahoo News or whatever it is, there are cases of kids now having this Kawasaki-like syndrome, middle-aged people having a stroke-like syndrome as well with this. So I'm just going through, I'm just giving more people permission to talk here. I see we got more people joining. Got a good group. And just remember to mute yourself if it gets too loud here. We got a good group of people. Jay Dobie, I love you. That photo's definitely your Zoom photo. It's like straight out of, Lawyers Are Us.
Thanks, Doc.
You bet, man. I love it.
Good.
What
Thanks
is that
for doing these, man. Really appreciate it. No, it's just my business photo.
Yeah. Well,
just
whatever business is in, you represent well.
Well, I was at a wedding, and they caught me off guard. I had a little smirk on my face. I'm like, I'll use that on my Zoom photo.
I love it.
Thanks, brother.
You bet. Excellent. So, okay. So that's one of the major updates that I want to give. That's what we've learned in the last week. And so the next thing that's really concerning is what I'm seeing is that, so I was driving around Michigan this weekend, just the area here, Oakland County, and I just see a ton of people out. Now, I'm seeing groups of people getting ice cream, and there's a point to this here. I got in our neighborhood here, there was a question of kind of should we kind of throw in the towel and let our kids kind of all play together? And I talked to some business owners, and they really want to get things up and going here. And let's just kind of talk quickly about that, because we know that we cannot all remain in our homes for 2 years. That's not going to happen for various reasons, right? There's a lot of reasons that we've spoken about on these calls. But we also know that as we move out of our homes and start getting back into society, that it's inevitable that infection rates are going to rise, okay? And as infection rates rise, you have mortality. Those two are linked. So there's a fatigue that is going on right now, and that is expected. There is a, desire a human desire to be around people, and there is a need for people to get back to work. All of those things are real. The issue here, and I'm going through this as well, and so I struggle and really try and think hard about this, is that my kids, I have two kids, and they're, under 12 years old, and they want, they need to see their friends. We can't keep them kind of tied up in this house for much longer. And I see them and I keep reminding them, stay 5 feet away, but ultimately they are, contaminating, right? Meaning they're breaching the 5 or 6 feet. And ultimately it will lead to an infection, right? A breach of our community, in a sense, right? A breach of my family or someone else's family. It's inevitable that that's going to happen. It may not have happened in this last week, but as this continues, that's inevitable. And I started thinking about kind of what do you do? How do I manage this? How do I weigh this? And in America, where we are tackling this very different than most other countries. This is one of the big issues. And because we don't think there are other choices, that there's no other alternative, or we have, we don't know what these other alternative, how going back into society, there's alternatives to what we're being given right now. When you look at places like Australia, New Zealand, South Korea now, there's a handful of others. There's about 7 to 10 countries that their curves have gone like this, almost like a bell. And that is a successful curve. And what that means is you're not escaping COVID-19, right? Remember, when we flatten the curve, the area under the curve doesn't change. And what that means is we're still going to get the same number of infections. It's just that instead of having them all at once, we're going to spread them out, okay? We will not escape COVID. But how we live with COVID is the questions that we really need to be thinking about. And what I'm seeing is kind of and it's not everyone, right? But I'm seeing it enough, is like a kind of what's the word here? Almost like a relinquishing of responsibility, in a sense, like there's nothing we could do, or let's just get out there and see what happens mentality. And I assure you that that's going to be the wrong mentality here, the wrong decision, because we're 2 months in this, and we have had significant social impact here as far as distancing goes. And apathy is a word that Danielle just put in there. And we are just at the beginning of this. And already, right, you're seeing people just going about this nonchalantly. And if we have 5 or 10% of our citizenry infected, and we're going to be 70% infected, the devastation that lies ahead of us is unfathomable. And if we think it was hard these last 2 months, COVID, if it hasn't already affected you, it will absolutely invade your life more than just having to shelter in place or stay at home. So, what I see happening is local communities having to make these decisions when it should be a national kind of imperative to put these things in place. And I think where we're at right now is that we are not going to see a nationally organized response for how we go out and live with COVID. And that has real implications. It doesn't mean we have to throw in the towel, by absolutely not. Quite the opposite. What it means is that we need to take even more responsibility to do the right thing. Our communities, local governments, state governments are going to need to do this. The countries that have been successful, and when I mean successful, I mean you have countries right now that their number of cases of daily infections is like 5 or 50. Okay, very, very small, and it's realistically it's not going to be zero, but they've gotten it to a point that's so manageable, and right, of those people that, right, people are still dying, and every death is someone's relative, parent, kid, sister, brother, something like that. I mean it's one of those things. And they're also kind of out and about. If you look at video footage, photos, newspaper articles, right, every single person that I see in these countries that have managed this, they're all wearing masks. Okay, they're doing their best, it appears, to be physically distancing. And they're living with COVID, right? They're living with it. We're not, there's no beating COVID, guys. We need to find a way to safely live with it and protect those that are at greatest risk. So this is a real, the devastation that we are going to see from this. How many, if you think about this, I think 70,000 people have died in the United States from COVID-19, 2 months in with sheltering in place. World War II, I think killed a few hundred, in the hundreds of thousands of people. Right? One of the worst historical events of our time. And that's exactly where we're headed here. And I think it's important that we psychologically understand what our behaviors in this country are leading us towards. Right? We have over 25% of the world's deaths, and we're 4% of the population. And that is only going to worsen. And with the law of big numbers, you're talking hundreds of thousands of people dying from this in how we're currently proceeding. So I'm sure that dose of reality has already kind of hit most of you. But as we are kind of, right, are humans, your memory fades a lot of times on negative things as you move further and further away from it, right? Evolutionarily, we don't like to remember kind of depressive times. And I feel like some of that it's similar in where we're at right now as a country, especially as the weather warms up. So 1 second here, I got to take a Cinco de Mayo break. The takeaway here is, I think, is we're going to have stages of this for the next year or two. We're going to have stages where cases seemingly are starting to decline, which is what we feel right now, even though our country, we're not declining at the rate we need to decline at. And I suspect, and things could change, but I suspect that we're going to start seeing increased infections by the end of May. Our curve will start increasing again. Unless there is some seasonality that we see, and seasonality, it may or may not be weather related. That's not the point here. It's just the incidence of infections, right? It's just the numbers. It will come and go. How kind of violently it comes and goes, that will be determined by the virus. So understanding that we just got into this first stage, and there may be 12 stages, 20 stages of this thing, is critically important for all of us. Okay. I just realized there's a ton of questions here. I'm going to try and go through some of these, and feel free if I've given everyone talking privileges here on Zoom. If someone feels, you want to jump in and say something, go ahead. I'm going to answer some of these questions here. Let's see here. Peter Sheehy, I'm joining a special committee for a school that will be planning for this fall. What types of health experts should we be consulting for guidance? Are you presently advising any schools, or can you suggest experts who are? Yeah, so this is a really, really great question. And by the way, there's two important things that come from this. So if you have I was on a conference call today with business leaders, CEOs of major corporations in the United States. I mean, people who own, CEOs who oversee multiple, chain restaurants. And here, this was fascinating. Right now, in the corporate world, the trust for businesses is the lowest it's been ever. And the trust for government, believe it or not, is the highest it's been forever. In fact, they commented that there is a bubble in trust of government right now. That's the data that they're showing. And what they believe that this comes from is that people need to cling on something, right? In time of crisis, you seek stability. And so if the government is able to hand out money, they're able to, provide support in various ways. That's what people are gravitating towards. But the takeaway was not that from this call. The takeaway was the time for businesses, and this is going to loop into schools, the time for businesses to have an impact, or any organization. Maybe you're even a real estate agent, right? I want you understand that this is universal. The time to make an impact is right now to gain the trust of people. And what that means is, are you providing a safe environment for your employees, and are you providing a safe environment for your customers? And the companies that are going to do this are the companies that are going to build the greatest trust. When a person sees that a company is not negotiating safety, that they will do whatever it takes to keep their employees safe and their customers safe, that action and behavior will go so far right now with the public that it may be the difference in who ends up surviving business-wise over the next couple years. To extend that out to schools, and to answer Dr. Sheehy's question here, this is a really difficult decision. And the most important part of this about schools is that we're talking about it, because there's no one person who has the right answer here. This needs to be group decision-making right now. Off the top of my head, you are going to need engineers who are familiar with spatial placements. You are going to need ethicists to be able to make decisions of who gets what resources. If someone may get sick, what do you do? And I think you are going to need mental health professionals as well, more than any. And then, of course, like someone who understands public health and implementing public health measures. Off the top of my head, that's the sort of team that I believe every organization needs to be hiring right now and consulting with. In order to get back, like if I'm going to go get some ice cream at a shop, I want the person serving me ice cream to properly be wearing a mask, right? To be using the best COVID practices out there of how they hand me an ice cream cone, right? There should never be contact between two people. And ideally, there's never contact, maybe, you're able to put something in, in some other material that I could grab it from that's never touched anyone. It's thinking like this that we need to be doing. We could do that locally. We don't need the federal government necessarily to do those things. What we need the federal government to do is to implement a nationwide initiative for testing, right? And contact tracing, but testing. And we are not going to get that. So hopefully that answered your question, Dr. Sheehy. And again, the most important part of this is having the conversation, having the discussion. Okay. Felicia, the birthday girl, can you discuss the rash associated with COVID? I think it's, non-specific. It could be anything. So I don't want to go into too much discussion about that. And to be honest, I just haven't spent that much time on the rash. Brian Gargano, is this disease mimicking sepsis, or is the body responding to it like sepsis, thereby causing the clotting, inflammation in blood vessels and heart? So, I'll just touch on this because we're going to find out more and more over the coming weeks and stuff. But ultimately, this is, you've heard of a cytokine storm. Anytime, sometimes when the body fights infection, it's inflammatory by nature. And what we're seeing with a lot of COVID cases is the inflammation's kind of just going overboard, right? It's over inflaming. And so that's where the idea of sepsis and all of these coagulopathies happening, right? It's just, imagine just mayhem, pandemonium going on with the cells in your body. That's the best way to think about that. Christy Connie, so I got my masks from Stadium and had to use one Saturday as I had to have a workman come in and fix my dryer. I did everything I could to tighten around my nose, and breathing test worked, but I still fogged up my glasses. Advice? So, I brought a box of these masks that I got from stadiummasks.com. You could get 5% discount if you use the code SAVE5. So just real quick, the three things for mask wearing, we'll do them in 20 seconds here. Put the mask on, okay? Pinch the top so that it's super tight, and you should be able to breathe so that you indent, okay? Don't touch the mask while it's on, and these are pretty comfortable. I could see myself wearing these for a while and get used to them. And then lastly, right, so that's number 2, don't touch it. Number 3, when you take it off, don't touch it to take it off. Just take it off like this and set it aside. As far as, you shouldn't have any air kind of in and out. Look, like I said, remember, when we when we're in emergency medicine residency and other residencies, you get tested for these, and they need to fit appropriately, that there's no release, no air release. And you can't see patients until that gets tested. This is not going to happen for the general public. So you do your best, okay? Eventually, you'll have a choice of sizes, small, medium, large. The ones that you have now probably just doesn't fit well. I would say, though, it's much better than not having one. And I would just go with that, Okay. It's the best you could do right now. And I wouldn't worry about physically distance yourself, wear your mask. That's darn good. Okay. Jason Littow. I'll answer this live. Our son needs to have some orthodontic work done. He needs to have his braces removed and a bridge put in. We have delayed these procedures since March, but it's getting to the point where we are considering going and doing them. Okay. Would you suggest waiting a little longer or just go ahead with the procedures? So here is the idea of what we just spoke about, right? What is your orthodontist doctor's office doing to assure you that it's a safe environment? And it's whether or not you do this, if he needs this procedure, you got to do the procedure. That's fine. But what safety measures is your doctor's office putting in place? Okay. What are they doing with their staff? Is there a policy that, are they taking temperatures? Are they checking symptoms? Are people wearing masks? Are they wearing gloves? Are they decontaminating? Right? Remember, I think I talked about this COVID compliant. I think this is a great business for anyone, right? If you were the certifying body that gave COVID compliance to offices, and right, this is not going away. This is going to be going on for a long time. But what is the COVID compliance level of that doctor's office? And if you feel comfortable, if they could assure you that they're all wearing N95 masks, and you know what? You could wear an N95 mask and a surgical mask over that. So if you're the person performing the procedure, that's what I would actually recommend. A surgical mask, an N95 and a surgical mask and a face guard. Okay. So that's what I think dentists should be wearing. In addition, they should be gowned. And if they have that in place, I'll go see that. I'll go see that dentist. All right. For sure. Okay. Sarah Oliver. If I donate blood, will they alert me if I had or gave the antibodies? I don't know about that. Probably not. I think you have to go to a place that does serological testing for the antibodies. I think everyone should get those, but the problem is right now that there are too many tests out there that are not FDA regulated. The FDA is reining in again. So what happened was the FDA just opened the floodgates. You had all of these tests coming in that were dysfunctional, that weren't accurate. They didn't have specificity and sensitivity. So there was a 20% chance that you were being told you had antibodies when you really didn't. But right now the FDA is honing in on that a little more, is really limiting some of this now. So as soon as there's serological testing, go get it, okay, from a reputable source here. How do I protect my 2-month-old from getting COVID-19 when people are ignoring social distancing and not wearing masks? I'm concerned that just by going to the grocery store or something like that, wearing a mask and washing my hands will not be enough. Yeah, so, the best you could do is physically distance, good hygiene, and, it's hard to put a mask on a 2-month-old. Leave them at home if you can. For the most part, 2-month-olds for everything that's happening, they're not being, they're not ill. Statistically, they're not being impacted. Of course, they could be a carrier for you or anyone else. It's the best you could do, right? There's no magic potion here, guys. And we do our best. And so you avoid crowds, you avoid places, you have agreements with neighbors. And unfortunately, if a neighbor can't agree with a certain condition, then you don't see that neighbor until we reach herd immunity. All right. There's a lot of misinformation about COVID-19, such as death, mortality rates being lower. How and where do we get reliable and accurate objective information on this disease? So the reality is that data is tough to get early on in anything, and it changes. And so you just have to be don't be political about this, right? Now, a lot of people are not trained in interpreting data, but what you are capable of doing is asking questions. What you are capable of doing is thinking critically and asking why or how or what. And you may not be able to interpret an article or data, but you could keep searching for more information. And think about what your sources are, right? If your source is from some .com that you've never heard about before, like, don't spend the time reading it. If it's from a reputable journal, a medical journal like New England Journal of Medicine, it's worth your time, right? Now, even though it's in New England Journal of Medicine, it still means it needs to be scrutinized. But it also means that it's already been through a pretty rigorous review. Common sense on one hand, and thinking critically, right? I was having a discussion yesterday with someone, and it was about conspiracy theories. And it's so hard to defend having a discussion when someone believes in conspiracy theories, because there's always an answer to why something is. And there's not critical thinking in these things. So if you apply critical thinking, you should be able to see past a lot of these fallacies of COVID-19. Like, for example, if you read an article that Elvis has returned because COVID resurrected him from the dead, and I'm using this as an extreme point here, like, if you just think critically about it, it doesn't make sense. So don't give that another moment of your time. But if you have, the Institute of Infectious Disease of the United States telling you something, it's worth your time. So remember where the information's coming from, and remember how that information gets to you. If it's from it went from a journal article to a mainstream media to some now offshoot media, it's gone through 3 iterations, and people are just going to pull out, the highlights of this thing, so just be cognizant of that. All right, we're getting down here. So next question. Is it realistic for us to stay away from children and grandchildren for 2 years? We have not been to stores, only curbside and food deliveries. Here's the issue with this, right? You're thinking, so this whole thing, this is thinking, and let me make that live. This is thinking without alternatives. This is thinking in our current environment. And what I could promise you on one hand is that our environment's going to change every day, every week, every month. It changes. If we had a top-down implementation of a testing strategy, we would not be asking these questions, right? If we were able to visit friends or family, and we could take a swab test to know if anyone there has COVID, or if you knew you had already been infected, none of that is going to impact. That decision is gone, right? So we're not helpless. This is hopefully not 2 years of wandering around, like trying to save ourselves in this environment. It is so critical that the people we rely on in crisis, and in a national crisis, it's the federal government, that they are able to implement a top-down strategy. And that is what you should be demanding. And that is what you should be asking for. And if someone's not doing it, then get someone in there that will do it. Because otherwise, we will be in exactly this place for 2 years where we don't know who's infected, we don't know who's protected and immune, and we're walking with our heads up our asses, scared shit and anxious And it doesn't have to be that way. See, it doesn't have to be that way. There's alternatives that we don't see the alternatives, and therefore you don't know they exist. But there are alternatives here. Hopefully that was helpful. All right, Dr. Brovman, by the way, if you ever need an orthopedic surgeon in the Denver, Colorado area, Jonathan Brovman, look him up, Bravman. He's an incredible orthopedic surgeon, and I don't want to say what your specialty is because I'm going to get it wrong, but I feel like you do knees, maybe shoulders and elbows, but I suspect you could do everything. All right. Would you recommend getting one, and how would you interpret an antibody test result at this point? Yeah, so today I searched for antibody tests around Oakland County, Michigan, and because I want to get one, what I'm going to do is I'm going to call up. I saw there was like these urgent cares that have them. I'm going to call them up and I want to ask them which antibody test, which serology test they have. And I'm going to look it up and see if I could identify what their sensitivity and specificity is. If it's not one that has 95%, sensitivity, or 95 to 100% specificity with a 90% or higher sensitivity, then I'm not going to take the test. I'm going to wait till I find someone who has that test, because the last thing I want is information that I can't rely on. I don't want to go and get a positive test and then be like, is it really positive? I just rather not know and continue to be vigilant in my behaviors at home. So hopefully that answers it. But I do think we all, if you have access to a high quality serological test, go get it. All right. But wait till I get it in Oakland County. No, I'm just kidding. Go get it. And share that. Like if you could find out what test is being used, let other people know. Okay. It's very, very useful. Okay. So a couple more questions here. Okay. My oncologist told me to not even consider having any surgical procedures at this time or in the next few months at least. I'm cancer-free, but still need procedures performed. He says, I'm putting myself at a huge risk for complications. I'm so conflicted. This one needs a Stella sip. So, if anything could wait, it should wait. This is another area where not knowing an alternative is, I just want to make sure, are we still on here? I think we're still on, yeah. We should still be on. Someone just give me a quick shout out, just one person. So
you're there.
All right, beautiful. Oh, thank you. Okay, this is the same type of question about whether I should get a procedure or not. It's thinking in this current reality, but this reality could change. And if you were able to go to your doctor's office and your doctor knew, everyone in that room had tested negative that day, then the risk is so low, right? And that's how we get back and open up society. The idea of opening up society simply in being interpreted as like turning your close sign to open is so inadequate thinking. It's so immature thinking and simplistic thinking. That is not what opening up society means. Opening up society means you have the infrastructure in place so that people are safe. We all know what we're dealing with here. And I know I'm not willing to go into a place that has 100 people there, uh, who's 50 of them aren't wearing a mask, and I don't know any, and there's risk of high concentrations of COVID. But if I was at a store or going to a medical procedure in my dentist's office that they were implementing some type of way that we knew that they were tested or I was tested and they're wearing the proper equipment, I have no problem going to a place like that. Okay, next question. This is an interesting one. So why would someone with COVID think water tastes like poison? Well, hopefully no one knows what poison tastes like, right? So I think what you're really asking there, the answer to that question is, COVID actually causes, and I can never pronounce this word, it's like dysgeusia, like altered taste. And it causes the lack of taste and altered taste. It also causes anosmia, which is lack of smell or altered smell. So that is a symptom or a sign, if it's really a symptom, I suppose, of COVID-19. It causes that, and so that's probably what you're talking about there. Okay, so that's all the questions right now, which is awesome. Right now, so gosh, we're an hour. That was quick, and we have a good group of people. I love seeing everyone here. Next week, I'm going to make it so that we could actually get some video going here. Oh, why'd that video end? That shouldn't have ended. The Facebook Live ended, but no big deal. Feel free, guys. If anyone wants to chat, you guys want to get on, say hi, ask a question. I think you could unmute yourselves. Don't be shy.
Adam, I had one more question about the task force dismantling.
Oh, I don't know enough about it. I just saw an alert. So yes, there is an alert that I saw that the COVID-19 task force is dismantling. Do you have any other info on that that's known?
Well, it was CNN, and they just said handing it over to FEMA and other government agencies is where it would go.
Yeah, I mean, who knows what's happening there, but implementing, that's fine if it's a agency that is going to be responsible, who is going to be able to implement, the infrastructure and systems we need. I don't care who does it, right? So there's someone, hopefully someone does it, because right now we're at 5% of what we need. Go ahead, Sarah.
The person that mentioned getting a procedure, that's interesting. My friend who's like early 50s went in, was doing all his pre-op stuff. I don't know what the procedure was. And the last test they gave him, and it's medical college around here, the last test they gave him was COVID. This was last Thursday. Next morning they call him like, you're positive. He had no symptoms really. And so now they have to push back that procedure. But I'm just surprised why they didn't do that test first rather than all these pre-op things. So he's got to wait another 2-3 weeks, maybe longer. He's got to test negative twice before he can get that procedure.
So I can't comment on so there's a lot of local pathways that people are using, right? And this is why it would be really wonderful to have kind of a generalized guideline that people could modify themselves. That is a really pertinent, I should say, comment, because it shows that people could have COVID without knowing they have COVID, right? Let's presuming that test is accurate, and that's scary. And that's, you don't see, like when you can't see that, the impact is tremendous. You guys want to sing happy birthday to my sister?
I was just going to suggest that.
I hope she has a birthday cocktail. I can't see her. I don't know. How to
I
see her.
know.
What? Wait, I missed you.
They're gonna sing happy birthday to you.
And yeah, she does have a birthday cocktail.
I'll tell you what, I can't lead. Do we have any singers on this call? Come on, there's always someone with talent.
Can
Gail
you see
Vogel?
me? Can you see me? I have a margarita.
You have a margarita.
I have Corona waiting for me in the fridge.
That's great.
You're representing, that's for sure.
Yeah, I think we have a lot of shy people on the call.
Well, thank you everybody for the birthday wishes.
I'll sing you happy birthday, Felicia.
All right, you lead. You start.
All right. Happy birthday to you.
Happy birthday to you. Happy birthday to you, Felicia. Happy birthday to you.
You are
That's got to be the worst.
that was memorable. Thank you.
I hope that's being recorded.
Any opera singers on or what? So,
Thank you.
yeah, good. I just got to say, right before this, I was exercising pretty intensely. I haven't eaten since afternoon, and now I just pounded this Stella. I'm surprised I could even comment anymore on COVID.
Adam, I've been laughing at watching you running because I remember the first time we ran the Run Walk Boom, the kids were in strollers, Ruby and mine, and you
That's
were
right.
like, we hate running.
That's right. Yeah. Well, it's a good thing, I think, if there's anything to do right now with our time, it's to improve some cardiovascular status, you know? I think that's good. I'm like flush right now.
Hey, I have a question, Adam.
Yeah.
So does the Kawasaki stuff change your opinion about summer camps?
So by the way, my opinion with summer camps is that my opinion had been that they should go on. We should have them. This Kawasaki-like syndrome definitely is concerning. We need more information, and that's why it's May, and hopefully in a month we could get a little more info. If those numbers creep up where they're significant, where there's a significance to it, not it's significant for those 12 cases, right? Then my opinion would change on camp. That I don't think we could risk that. There'd be too many kids coming down with this.
And school too, right?
Yeah, it would apply to any groups of people anywhere. Yeah. And then I think it's it's where we have to have ethical questions of what does society do? Right, because don't rely on a vaccine. While I believe strongly in our scientific community, I was just reading more today. The strains of COVID, SARS-CoV-2, they're rapidly mutating, and we have yet to find a vaccine for the common cold. We have yet to find a vaccine for influenza that's 100% effective. There's no reason to believe that this will be different, especially in such a short time frame. I did read an article about an Israeli scientist they found an antibody. I think it was an antibody that blocked COVID. That's a good approach for sure. I'm just I'm like 50-50 on the vaccine. I don't see a vaccine being the answer here at all. I think herd immunity is the answer. I think ultimately we could go back to this video in 2 years, and I'll wager on herd immunity, no vaccine, effective vaccine. Yeah. So that means, right? Why did I bring that up? That means, do we not have kids in school until we reach herd immunity? And I don't think that's, I think societally, kids are already kids are at risk now for things in school. When we, 20 years ago, 30 years ago, there's chicken pox, and that could cause encephalitis. For that, there's polio, right? There's always something, and society managed that. They weighed those risks, and some were unavoidable. So I think those are the discussions. And so if the incidence of COVID-19 related Kawasaki, if it's 0.25%, I think our society accepts that. If it's 25%, no society should accept that.
That's the same thing that we're seeing in the UK, right?
Exactly the same thing. Yep. Guys, I just want to comment here. You guys are the core crew right now. I'm looking at the screen. I see everyone's name. You're the core crew. You've been with us. You've been together. We've been together now for like 2 months. Just want to thank you guys for that.
I have a question.
Yeah.
If somebody is COVID positive and is in the hospital and their Coumadin levels over 5, what could be the reason? What could be the side effects? And they were put on vitamin K.
Yeah. So INR level over 5 could be due to anything. It could be just metabolic issue. The reality is, whoever is controlling that, they'll get it under control. Yeah, I mean, it could be COVID related, may not be. I mean, it's COVID related in the sense that they have COVID and their INR is over 5.
The patient was on Coumadin.
Yeah.
And was taken off Coumadin.
Yeah. Now, what's interesting
is on other medications that could raise the Coumadin levels.
Right. Exactly. Yeah. They'll get it under control. It's one of those things like where I look at Coumadin in a sense of, right. It's like flying a plane on the horizon, right? Like, you don't want to go too high, you don't want to go too low, and you just need to find the right level, and they'll find the right level. Now, what's interesting though, is because Coumadin actually COVID is causing this hypercoagulable state. It's causing a state of clot that being on Coumadin is
right.
Part of that treatment.
Thank you.
Yeah, you bet. What else, guys?
I mean, I'll have another question.
Yeah, I mean, all I have to do is cook dinner. So the longer we could go, the more.
All right, another patient had oral surgery the day before her husband was admitted to the hospital, and she has tested positive for COVID-19, and she had extreme inflammation in her face with bruising, and she would wake up every night with her tooth throbbing. Obviously, she had the tooth extracted, and it looked like her lymph nodes were swollen and all sorts of other issues. She is 88 years of age. Do I need to be concerned with some issues? She also has high blood pressure. And she's alone.
And you said she's COVID positive?
COVID positive.
When was she positive?
Yesterday she found out she was COVID positive.
Yeah, you should be concerned. Absolutely. One of the progression of COVID, what we're seeing is that in many cases you could actually get better. It looks like you're getting better and then you take a turn for the worse on like day 5 or day 7.
Okay, so she's probably day 5 or so right now, and she's the one that lost her taste and smell, and her husband is in the hospital.
Yeah, it's fascinating. You know, I have just anecdotal. This is anecdotal only, but I believe that in those strains that people lose their taste and smell, that they usually do all right. They
That's
recover.
what I think too. And she's feeling all right for
Yeah.
now. But her husband is still in the hospital, and they are talking about possibly releasing him to another facility.
Yeah, I mean, you need to be right. I mean, we need to be concerned about any COVID positive patient who's older age.
And he's still on 3 liters of oxygen.
Yeah.
And he's still getting dialysis.
Yeah, I mean, right. They're not better until they're better, right? And it could be 10 days, 2 weeks.
Could be 3 weeks, right? Or 5 weeks.
Yeah, I mean, most of the time though, so there are people who are severe for that long, but for most of so you will know, right? It will declare itself within, 1 to 2 weeks. Like it will declare itself. Are you going to be severe or not? That should be the case. And I see Rebecca Rogers is on. How you doing? I saw you had a question. My mother-in-law asked, how you doing?
Hey, Adam. Thanks for.
Yeah, you bet. What was your question?
Oh, my question was the masks that you bought, how many times are you going to use them until you discard them?
So great question. There's no right answer. I think it's like setting specific. So I work from home now. I don't venture out too much. So I would use I just don't need a mask off like that much, right? So there's someone like me who, I go out once or twice in a week, maybe I use it, and if I feel like I have a good enough supply, I don't know, if I misplace it, I may end up misplacing it. But you can rewear them. You certainly could wear them, multiple times. People, I was talking to people, like in the ERs, what they're doing in the ERs now is to preserve the masks. I mentioned this, they're putting on an N95 mask and then a surgical mask over it, so that it's just nothing's touching this N95 mask, or very little's touching it. But to just answer your question more directly, are you like, would you need it every day? Like, would you need one every day?
I mean, if I go back to work, yes. Otherwise, just to run errands, like go to the store.
Yeah, I may. You'd have to just look at like the integrity of them, like if they start like if you see wear and tear, I would dispose of it. Just remember, the masks are a secondary, right? It's a second precaution. Physical distancing is number 1, and then the masks number 2. It's not that if you have a mask on, you should be up close to someone, right? It's not, and I know you guys know this, I just want to reiterate it. Having a mask doesn't grant us permission to get up close with someone unless you're in that type of interaction that you need to be. The mask is just a second barrier that you should have with physical distancing. I think if you wore one until it wore out, you're totally fine with that. There's a lot of unknowns. I think if you want to be, going out to the grocery store, coming back, not like you're not going to cause much damage to a mask that way. For example, before I got these, I had one N95 mask that I've had for a while, I still have it, right? That's what I wore to the grocery stores. And I wore it at least 4 or 5 times, and I still have it. So that worries me less. As long as it looks good. If it looks like it has integrity, it probably has integrity for sure. Yeah.
Thank you.
Yeah, you bet.
I have a little follow-up to that question.
You bet.
By the way, thanks for all these very informative sessions.
Oh, my
And
pleasure.
thanks for advising about Stadium, where I also got the masks. The follow-up question is, if we wear those masks, and well, actually, is it safe, and would it be advisable to give a little spritz of either like a Lysol or a hand sanitizer or something?
I would not do that. I think that intuitively, it seems like maybe we should do that, but I would not do that. I think you're at greater risk of destroying the integrity of the mask. There are ways to sanitize masks. There are ways to do it through hydrogen peroxide, potentially UV light. But no, I would just say I would not venture into that until maybe there's more information. I don't know enough about it, I guess, to comment confidently about it. So for me, I would not do that. Yeah, I'll leave it at that.
Sounds good. Thank you.
You bet.
I have another question.
Yeah.
Speaking to the warmer months coming and air conditioned use and going into a public place, what's your concerns? I know there's a lot of information out there now.
I have no specific concern about air conditioners and COVID as of today. I would actually say that it is better to have airflow. We know that COVID is aerosolized, and so from speaking, you're going to have viral particles that are just kind of out in front of people, and the more airflow you could get to disperse those viral particles, you're probably better off because it dilutes those particles, right? It's very rare that you would get like a single viral particle that infects you, right? It's more about clusters, groups of these that infect you. So the more airflow, the better, right? One of the reasons why groups of people is always a risk factor for infection, meningitis, right? Tuberculosis. It's that if you think about anytime groups of people are together, it's usually in areas that don't have good airflow, right? Army barracks is a classic case of this. University dorms are a classic case of this. And so if you think about an open office space that has good airflow, that worries me much less.
So I know in China, they've opened up schools this week. And the number one thing was they will not put on the central air conditioning.
Yeah, I don't know enough about that. There are diseases where air conditioning actually increases the risk, right? Things like Legionnaire's disease, Legionella pneumophilia. It's a bacteria and it loves water, right? And so it infects air conditioning systems and spreads that way. I absolutely could be wrong on this, or maybe the Chinese are wrong. But from what I know of virology and infectious disease, the more airflow, the better you are. I mean, there's less likelihood, I think.
I heard the window units are better, but the central air is more dangerous.
There's no way we know about. Like, there's no way anyone has an answer to that that's accurate, right? There's no way we know. I think central air classically has been associated with more disease, right? In like Legionnaires, it's like the classic disease that's associated with any water and air conditioners. There will be more information about it. Anyone who says it's this or it's that with confidence, be wary of that. I wouldn't comment on. I don't know enough about it. So,
Thank you.
yeah, I think that's the least of our worries right now. Like, not the least. I don't think that's something to like concern yourself about right now. Yeah.
I think what's concerning is the amount of people I see that are out and about without masks.
Yeah. Yeah. That's the greater focus.
Hey, Adam, along those lines, water is, I'm just thinking about the summer and people wanting to go swimming. If you keep appropriate social distancing, or we're in a pretty remote area where we live, is there any evidence that the virus is carried in water or no?
I don't know enough to be 100% to be certain about that. I could tell you that it would be unlikely that the virus could survive in a chlorinated pool or a lake, that it would be infectious to you. What I could tell you about swimming pools is it's not necessarily the water, but it's when kids are jumping around one another that is the issue.
Yeah, that makes sense.
Because they're spitting and hitting and touching.
Yeah.
Yeah. So like I have full intent of going to northern Michigan this summer and swimming in a lake. Even if there's other people swimming in it.
Thanks.
Yeah, you bet. All right. Jen Lee, you've been quiet. Are you still there? Or is this your stand-in?
It's me. I'm quiet, but I'm listening. Thank you.
Wow.
Thanks for the shout out.
Yeah. And is my mom still on this call? She probably doesn't know how to figure out how to unmute. I'll unmute for her. You there, Mom?
Marsha.
Yeah, she probably
She's so cute.
she'll be on Zoom for a week now. It will be logged in for a week.
She says, I don't know why it doesn't work.
You have to call it the right way. You have to say, Ma.
I'll try it again. Ma, you want to say something? Yeah.
She's not sure what she's even on.
Yeah. That's great. Well, we'll I guess what we'll do is we'll wrap up. Carrie Klinger, anyone with Dr. Flowers? Any
Phone. Where is the microphone?
In the other room.
You can't find
I don't think she wants us to answer that.
Hey, the microphone, Ma.
Wait, talk on the phone. Let her talk on the phone.
Yeah, I'll put you on speakerphone.
She does not want us to answer that.
Wait, we got her on the phone. She's going to talk on the speakerphone.
Oh, you guys are together?
Talk.
No, I'm in my house. She's in her house. Talk, Marsha.
Make it loud.
Oh boy, turn her off.
Marsha, talk.
Talk, Marsha.
I'm talking. Great job. And happy birthday to my beautiful daughter.
Thanks, Mom.
All right, what we'll do is so this week, our goal.
Where is the microphone?
It's in your finger.
Me.
It's in your finger.
Oh, shush. Why are you embarrassing me?
Yeah.
You're embarrassing yourself.
Can you mute her? Mute her.
Yeah, I did. So what we'll do is her task for the week will be to learn where the microphone is. And let me just double check here as far as time goes. Next week should be good. So we'll schedule it, see if there's any updates or anything like that. And if there's anything that you want to talk about, make sure that you bring it to the group and we'll talk. Other than that, how did you guys like the Zoom format over Facebook Live?
I have a question about it.
Yeah.
Did you set it up so that everybody cannot see each other?
Yeah, I got to figure that one out. I think because I did webinar style that it did that, but I have the other subscription. I have the other, we could do it so that everyone could see one another too.
Sure, because I mean, if we don't, it's very similar to doing Facebook.
Exactly. And I hate talking to screens.
Yeah. I mean, it would be nice to see everybody.
Yeah, we'll do that for next week. I'm gonna set that up.
Cool. Thank you for the well wishes. I really appreciate it. It was a really nice day, actually.
Good. All right, guys.
Thanks so much, Adam. That was awesome, as always.
Oh, my pleasure. Very welcome. The highlight of the week. To see you guys.
Thank you.
Bye.
All right, guys. Have a great one.
Thanks, Adam.
You
You
too.
bet.
Thank you.
Ciao.
Bye-bye.